Good morning, everyone, and welcome to the Hawaii Health Data Warehouse's Coffee Break Monthly webinar series. I'm Tanya Lowry St. John, and I'm the Public Health Epidemiologist with the Hawaii Health Data Warehouse, or HHDW. I'm also research faculty now at the University of Hawaii at Manoa Office of Public Health Studies. We're going to be using the next 30 minutes to introduce you to the Healthy People 2030 tracker and the Hawaii Health Matters website. So thanks for joining us after the long weekend. So Healthy People actually started back in 1979. Surgeon General Julius Richmond issued a landmark report titled Healthy People, the Surgeon General's Report on Health Promotion and Disease Prevention. And then in 1980, the Office of Disease Prevention and Health Promotion released Healthy People 1990. So it actually was first released in 1980. That was then followed decades later by the new iterations of Healthy People initiative. So we are now in the 5th iteration of Healthy People. The National Centers for Health Statistics, or NCHS, is responsible for monitoring the nation's progress and making the documents available through healthypeople.gov. So that's something I'll show you how to get easily to that website in a minute. With every iteration of Healthy People, they change the number of indicators that we look at. So I would say that back in 2000, it contained 319 unduplicated indicators in 22 priority areas. There was 376 in total. 2010 was 467 with 28 focus areas. They ballooned up in 2020 with over 1,300 objectives in 42 topic areas, and we're now back down to 355 objectives. Besides the objectives, each one has a different sort of focus, and it's become more comprehensive as time has gone on. So here for Healthy People 2030, the goals for this decade are very broad, and they are to attain healthy and thriving lives and well-being free of preventable disease, disability, injury, and premature death, eliminate health disparities and achieve health equity, attain health literacy to improve health and well-being of all. The health literacy focus is new for this edition of Healthy People. Create social, physical, and economic environments that promote attaining full potential for health and well-being for all. Promote healthy development, healthy behaviors, and well-being across all life stages. And then engage leadership, key constituents, and public across multiple sectors to take action and design policies that improve the health and well-being for all. So you can see this latest iteration is quite broad. Through this, they're doing it through a series of 355 core objectives with 23 leading health indicators. The leading health indicators, or LHI, are a small subset of high priority Healthy People 2030 objectives that are selected to drive action towards improving health and well-being. Most LHIs address important factors that impact major causes of death and disease in the United States. The 2030 also includes 2 other kinds of objectives. They have developmental objectives, which are high priority issues of interest with evidence-based interventions, but do not yet have reliable baseline data. And also research objectives, which are areas where there's a high health or economic burden, or there's significant disparities between population groups, but more research is needed to identify evidence-based interventions to improve health. So as you can see here, there's a theme. They try to focus on things that not only do we see that there's a difference, but we actually have an evidence-based intervention, and we also have baseline data. So those are where you're going to be your top 355 core objectives. The objectives are organized into topics by health conditions, health behaviors, populations, settings and systems, and social determinants of health. And they're all kind of cross-linked. So here's a quick little graphic that they provide about thinking about their objective and measures. So their vision is a society in which all people can achieve their full potential for health and well-being across the lifespans. They're looking at overall health and well-being measures and in 8 sort of broad global outcome measures. And their core objectives, they've got the 355 objectives that have 10-year targets that are associated with evidence-based interventions, your leading health indicators, and then developmental objectives, which are, they have evidence-based intervention, but no data, and research objectives when they see that there's an issue, but there's no evidence-based intervention. This is a list of the 2030 leading health indicators, and they're done across by life stage. They have an icon system that you can learn more about at their website. For these 23 leading health indicators, we've managed to capture most of them, the vast majority of them in our tracker. The ones that we're not able to get local data on are consumption of calories from added sugars by a person under the age 2 years and over. That's going to involve a much more detailed food questionnaire than we have in any local surveys, local population-based surveys, I should say. And the other one is people who know their HIV status for 13 plus years, and that's based on not just self-reported HIV status, but their blood tests. And again, we don't have that kind of data here for Hawaii. Before we move on to the Hawaii Health Matters website, I want to remind you a little bit about our rubric in the website. We try to present data in context. So you're not just seeing one piece of data, but you have some more information by which to interpret those data. And we use the data and the icons, we use colors and symbols to help you interpret those point estimates. So general guidelines are that whenever you see red, that's bad, it's going in the wrong direction. Green is good, it's going in the right direction, and blue is neutral. When you see a solid trend, that's statistically significant. If it's a mostly white trend, and then it's not statistically significant. And then you'll see here that we'll have a check or an X. Checks means that the target has been met. You'll see here that it's green, and then the X means that it has not been met. So let's take a quick look at what that's going to look like as we go through the system. So here we have 4th grade reading skills, and the state value is 33.8% measured in 2019. It is lower than the US value, and that's bad in this case, so it's red, but it is trending upwards significantly over time, so we are making progress, and we have not hit the Healthy People 2030 objective. And this next one, you can see that we have the homicide death rate, and you can see for Hawaii, for the time period, the average between 2017 2019 is 2.5 per 100,000 population. We're again lower than the national value, but in that case, this is good because you want fewer homicides, right? So it's green. Unfortunately, we're trending upwards, which is bad in this case, so it's red, but we have met the Healthy People 2030 target. Our Hawaii Health Matters HP 2030 tracker contains over 60 state-based indicators for HP 2030 objectives, including 20 of the 30 leading health indicators. But something to pay attention to as you're going through our system is that HP 2030 is designed to track national progress towards health objectives. So it uses over 80 national data sources. Some of these data sources are not collected in Hawaii, or the sample size collected in Hawaii is too small to yield a state level estimate. So for example, the NHANES and NHIS are not collected in Hawaii, and they're major sources of data for Healthy People 2030. So in these cases, we use state-based alternatives such as the BRFSS or the YRBS to provide a more detailed local data. In the indicator view, you want to hover over the target to learn more about the indicator and the source for the state and national data. So for example, here, we're taking a look at hovering over the HP 2030 target, which has been met. So we said compared to the target, which is this, it has been met. And here in the technical note, you'll see this is C07. So that's cancer 07. So we'll go into, if you hit C07 and the HP 2030 website, it'll give you more information about this particular indicator. And you can also see that it is increased proportion of adults who get screened for colorectal cancer, what it is, the name of the indicator, and that it is a leading health indicator. They're not all leading health indicators, but for the 20 you'll see that information. Below that, you can see that the national indicator for this is defined in exactly the same way. So the data source for the national indicator, though, is the National Health Interview Survey, from which state-level data from Hawaii cannot be obtained. So the state data source is the Behavioral Risk Factor Surveillance System, which is comparable to the national data source. And you'll find this information in the system for each objective if you want to see, are we using exactly the same or are we using a proxy? So then let's go ahead and get started. I start at our Hawaii Health Data Warehouse page, hhtw.org, because I don't like to remember a lot of things, but you can go ahead and click here on the green button, or you can also go ahead and click on Hawaii Health Matters here. And this should bring you to the Hawaii Health Matters page. In this, you should be able to see, then we have our featured content for this month, which happens to be the Healthy People 2030 tracker. So if you click on that, you'll go there. It's a little scroll through in a second. You can also see that our focus on for this month is going to be the tracker. So we have a bunch of different, 4 different indicators from the tracker to sort of see how we're doing, how Hawaii is comparing to the national objectives on these. So you can click on any of these and they'll take you to that objective. And then also first you can sign up for next month's coffee break. It's not here yet, it'll be here later on in the day. So to get to our tracker, you can come to track progress, and the HP 2030 tracker is our newest, 2030 tracker is our newest, so it's right there. You could also just click on the track progress page, and that'll bring you to our list of currently active trackers. And we'll go ahead and click on the HP 2030. And this brings you to our page. So we'll have a little bit of background information about the tracker. You can click here on this link, and that will actually take you to the Healthy People 2030 page, which is a really wonderful resource for all kinds of information about the Healthy People 2030 initiative and national objectives, and for any of our objectives. So for example, we talked about C07. If you go ahead and click into here, you'll say, all right, then this is the increase the proportion of adults who screen for colorectal cancer, and you can find out more about how this is defined and what is being used. Okay, so back to our tracker. So we'll scroll down, and so you'll see that the information is organized by topic area in Healthy People 2030. So we have some indicators from adolescent health, access to health services, cancer, chronic kidney disease, diabetes, education, community-based programs, environmental health, family planning, heart disease and stroke, infectious disease, there's a whole bunch of new ones there, injury and violence prevention, lesbian, gay, bisexual, and transgender health. One note for this is that right now the national objectives are only based on lesbian, gay, and bisexual health, because many states and nationally they don't have a good data source for transgender health. We do in Hawaii, and so one of the activities will be to kind of look at where you would find that information for us. Mental health and mental disorders, maternal, infant, and child health, nutrition and weight status, oral health, physical activity, social determinants of health, substance abuse, and tobacco use. So these 60 plus indicators were actually prioritized by the Department of Health for our initial launch into the Healthy People 2030 tracker, and we will be adding more data onto into this tracker as we go forward. All right, back to the tracker. So you can see we have the indicators here. You also will notice that we have the locale toggle button. So you can go through and say, this is what it looks like for the state of Hawaii. But if I'm interested in a county, I can go ahead and click on a county. Not all the data is available at the county level, but the data that is available at the county level in the tracker will then be shown for you. So you can see now how your county is doing. So in this case, Kauai, how is it doing compared to the Hawaii value and to the 2030 target? So these comparisons are dynamic and they change depending on the locale you're looking at. So we'll go back up to the state and we'll go ahead and take a closer look at one of the indicators. So as we've already talked a little bit about colorectal cancer screening, let's focus in there. So here as our standard indicator report, you'll get the title of what it is. You can see your location and also your measurement period. You see the little drop-down arrow so that you can adjust those. This will give you the definition of what we mean when we're talking about colorectal cancer screening. In this case, this is in accordance with the Health Preventive Task Force guidelines, and a little information about why colorectal cancer screening is important. So you can see that this is the data for the state of Hawaii, how we compare to the median across all states and territories, because this is BRFSS data. Our prior value, our trend over time. This was also a Healthy People 2020 target, and it's a Healthy People 2030 target. And again, you can see as we hover over here that it is a leading health indicator. The technical note will show you what indicator it is, and then also how we used Hawaii, what data we used in Hawaii to be able to get data for this tracker. Another piece that you can see, and it's available for many of our indicators, is we have data by subgroup. So again, that same framework applies in that red is bad and green is good and blue is neutral, and these are all compared to the state value so that you can see that for a state, while we have met the target at 75.1 for the state as a whole, for people who have education level lower than high school or high school only, they have not met the target for colorectal cancer screening. So there's still room to be had there, or gains to be made. And you can go through and you can click on the other subgroups that are available and see how we look at by employment status. So unemployed are most at risk, people in the lowest percent of poverty level at risk, no difference by race, ethnicity, by sex, or by sexual orientation. As you keep scrolling down, you can also see that this is one of the indicators that is available by many different geographies. Let's take just a quick look at county data. And you can see here, this is how our counties are doing in terms of colorectal cancer screening. You can compare them by looking at our comparisons. You can compare them to the Hawaii state value. So you'll see that Hawaii County and Maui County are not doing as well as Kauai and Honolulu, or lower than. You can compare them also to the 2030 target. So again, we can see that there are, even though the state overall has reached the target, there are still populations at risk. This group of objects here is one of those that as you highlight on one, it highlights the adjacent thing on both the map and the chart below, or if I'm highlighting here, I can highlight on the other two sides. So it's one of these neat little tools that we have. And then again, you can go down and you can find that there's even more information all the way down to CDC places, and we have indicators and reports here that may be of interest to you. So opening up your browsers, take a look and see if you can spend a few minutes answering some of these questions. So my questions are, what % of adults with hypertension have their blood pressure under control? What does a trend look like? And what HP 2030 objective is this based on? And then compare the national and state data sources. Are they the same? What proportion of LGBT teens are bullied? How do they define bullying in this? And how does this compare to national data? Where can we find data for trans and questioning teens? And which county has the highest death rate due to drug poisoning? How does it compare to HP 2030 objectives? And what is the trend? So I'll let you spend a little bit of time working on this. And then I have a final poll for you and we'll go through the responses. Okay, so what % of adults with hypertension have blood pressure under control? So that's going to be down in the heart disease and stroke area. So you can see that it's 58.4%. What does the trend look like? So you can see that it's going down, but not significantly. And then what HP 2030 objective is this based on? To find out that information, we actually have to open up the objective itself. Excuse me, the indicator. And you'll come here and you'll see that it's HDS 05, so it's increased control of high blood pressure in adults, and it is actually a leading health indicator. Compare the national and state data sources. So while the indicators are defined the same way, the data source for the national indicator is the National Health and Nutrition and Examination Survey. And that's a survey that's actually done when they do a physical exam of somebody. It's not just what they're reporting. And that is not conducted here in Hawaii. We do have in Hawaii the uniform data system, but it's just for federally qualified health centers. So the data is collected comparably to the national data source, but it's not exactly the same. So it's important that you understand that as you look at it, but if you want to know how we're doing in Hawaii, this is as close as we can get to sort of an objective data source to see how we're doing. The next question is, what proportion of teens, of LGBT teens, are bullied? And if you come down here to our LGB section, you can see here that it is 25.8%. And how does this compare to the national data? In 2017, it was 33%. And then where can we find data for trans and questioning teens? And you can see here that additional information about bullying among transgender and questioning teens is available through Hawaii IBIS. In our system, if you go ahead and click directly on the youth risk behavior, this actually brings you to the bullied on school property question. So this is where it came from, and you can come through here and you can modify your query definition and go ahead and say, I want to look at it by sexual orientation by sex or transgender. So it allows you to dig deeper into that same question. So that's available to you all here in one place. And then the last question that we had today was, which county has the highest death rate due to drug poisoning? And we'll just go back here. And that's going to be under substance use. So death rate due to drug poisoning, we can go ahead and click on here. So this is for our state value. So we're going to want to see what the county level is. So we're going to go click here. And then we can see that while overall as a state, we're at 15.4%, which is below. I'll go ahead and put the state rate up here so you can see it. It's 15.4%, 15.4 out of, excuse me, it's not percent, out of per 100,000. You can see then that Hawaii County is significantly lower than Maui and Kauai and Honolulu County. The highest is Honolulu County, which is at 16.3%. You can compare it to the HP 2030 objective right here and say that the objective is 20.7. So even though we have some differences among our counties, they are all significantly below the national objective. And if we want to say what the trend is over time, the trend is increasing significantly over time. So next month, we're going to do back to the basics, and we're going to go doing an overview of Hawaii Health Matters and what are some of the tips and tricks to get the most out of this system so that you can understand the data that is there. and that will be on Tuesday, October 5th at 11 a.m. And we're doing this because we have been working very furiously behind the scenes on our big website overhaul, and hopefully we'll be debuting that for you in November. But we do hope that you will join us and sign up to come and see our webinar in next month for tips and tricks. And we'll be using your poll responses to help focus some of the content of that webinar. And then those are the answers for this week's activity, or this month's activity. But we'd love it if you could join us next month to learn more about the Hawaii Health Matter System overall. And then hopefully in November, we'll be ready to debut the big changes. So I thank you for your time today and appreciate your attendance.